Heyo everybody, I'm the Kernel and welcome back to Kernel Games. Today we're going to be playing something a little bit different. Today we are going to be playing Surgery Squad, which is an online surgery simulator that is not Surgeon Simulator because Lord knows that's overdone. So I figured I'd give this a shot. I've seen a couple other people play and they look kind of, well, gross, but fun-ish, and we'll see how it goes. Today we're going to be performing an adenoidectomy, because Lord knows that's what I want to perform whenever I get done with 15 years of medical school. So, let's get started. Quick load. Here we go.
Hello, and welcome to
Hi.
Surgery Squad's virtual adenoidectomy.
Well, thank you.
I'm Dr. Susie, and
Hi,
I'll be
Dr.
guiding
Susie.
you through this procedure today.
You better be.
Our
because I have no
adenoids
idea
are
what I'm doing.
located at the back of the throat, just below
they?
where the nose connects, also known as the pharyngeal tonsil. They are part of our immune system because they protect us from the bacteria or viruses that might enter the body when we breathe or swallow. They are more important for children than adults, and they shrink as we get older. In some adults, they become inflamed, which can lead to infections, sleep
We'll learn it
apnea,
today.
better known as snoring, and ear infections, since enlarged adenoids might block the eustachian tubes, which drain fluid from the ears into the throat. Normally, these symptoms can be treated with antibiotics, but when these infections occur more frequently, we perform an adenoidectomy to remove them. Having an adenoidectomy, if it is required, can reduce the number of ear infections, reduce recurring chances of sinusitis, and can alleviate sleep apnea.
That sounds fun.
However, there's a risk of developing an infection at the removal site. Plus, the procedure might not alleviate all the problems associated with adenoids.
Well, then what's the point?
For instance, if ear infections continue, the problem might be elsewhere. Our patient today experiences sleep apnea and ear infections. Let's scrub in and get to work.
Handsome guy.
We'll need to use a general anesthetic for our patient. Why don't you help out? Can you find a suitable vein in the patient's hand?
That's what I was going to be doing. Click to identify a suitable vein in the patient's hand. I'm assuming it's right here.
Looks good to me. Sterilize the injection area using a sterile alcohol wipe.
Wipe it down, wipe it down, wipe it down. What am I doing? Why does that keep happening? Oh, there it is. I didn't have to rub it. I just had to click it. Is he wearing fake tanner?
Insert the needle and advance the angiocatheter into the vein.
The angiocatheter. Click. Ugh. No.
The small burst of blood in the angiocatheter hub is what medical professionals refer to as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. While placing a small amount of pressure over the vein to collapse it, remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed.
Oh, I hope not a lot of blood spurts out. Please don't. Oh,
now that the needle has been removed, I'll dispose of it in a sharps container. We need to secure the IV with tape and test the line.
Take that shit down.
Great! Now we'll wait a few minutes for the anesthetic to take effect.
Let's get him real numb. 10 minutes later.
One more thing.
Oh, he's real
Since we'll
asleep.
be working in the patient's nose and mouth area, we'll need to make sure he can breathe. Let's insert a breathing tube into one nostril.
Breathing's kind of important. Ugh.
Great job. Our patient is under and breathing. Now we're ready to remove the adenoids.
Did you see that?
We'll begin by putting an endoscope through our patient's nose so that we can view our work on a monitor. When we reach the back of the nose at the entrance to the throat, we'll be able to see the adenoids. Okay, good. Now we can see the adenoids. We need to open the mouth and get the tongue out of the way so we can begin our procedure. To do that, we'll use a special retractor that opens the mouth, depresses the tongue, and locks into position.
Locks in a position. Click the retractor onto place to open up the patient's mouth.
Great work! We're going to remove the adenoids using a device that uses suction cautery. The device uses electrical pulses to liquefy the adenoid, then suctions the liquefied adenoid out. This method is faster and results in less bleeding.
It's grody, man. Ugh! Oh, God. I don't think I want to keep doing this. Oh, that's disgusting. Thank God I don't want to be a doctor. Mm-mm. No, 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 no. What is that under there? Oh God. Oh dear God. No. I'm so sorry, guys. This is disgusting. No, I don't like it. I really don't. I swear, if I have to have this done to me, I'd rather deal with the sleep apnea and stuff. Okay, we're getting the last bit of it out, maybe. Oh, thank God.
Fantastic!
Oh
The
God, that
adenoids
looks
are gone.
disgusting.
Now all we have to do is remove all of our equipment and get our patient to recovery.
Yeah, get that
Our
shit
patient
out of
is in
there.
recovery,
Wait,
and he'll be able to go home in a few hours
he's
once he
Indian
can
now?
breathe easily, cough, and swallow.
I didn't know
We'll
this could
prescribe some antibiotics,
make
and
him
once he gets
change
home,
his
he needs to
ethnicity.
drink plenty of water to keep hydrated. He'll also need to stay
So
away
need
from
more than
solid
water.
foods, but he'll get to eat ice cream, sherbet, popsicles, and jello for
Well,
a
that's
couple
a
of
good
days.
thing.
He
Woo!
might experience a burned taste in his mouth, which will subside after a couple of days.
Define burned.
He should brush his teeth often to help alleviate
Like
that
chicken
taste.
burned, or your mouth
Scabs
is on fire
might form
burned?
in the back of his throat from the surgery. And, of course, he should contact his doctor if there's bleeding or excessive pain
Well,
from
I
where the
hope so.
adenoids were removed. You did a great job today.
I tried.
Try your hand at one of our other surgeries here at surgerysquad.com.
Alright, well, that was Surgery Squad. That was one of the shorter ones from what I've seen. And I might play this again sometime. I'm not sure. Depends on how my stomach feels. But, I mean, it was kind of fun. If it didn't make me throw open my mouth. But, I guess that's it, guys. Ugh, I can't imagine how to sleep. Anyway, I'll see you guys later. Have a good one.